let you know that it's okay for you to unmute yourself for this webinar. If you do, I'm getting feedback. Uh-oh. I don't know why that's happening. It just started happening. But if you want to speak, clearly you unmute yourself. But if you are concerned that there might be some folks coming into your room that might want you to talk to them, I would highly encourage that not happen. But if it does, you need to mute things in terms of any disruption. So first of all, I want to welcome all of you to this webinar. I want to be very honest and let you know that I have never facilitated a webinar. We probably will not be going all 2 hours. I hope we will, because I hope you guys are going to participate. This is not going to be me talking for 2 hours, so don't worry about that. But it is, we want a lot of dialogue between you all. And I do ask that, I know that it's very difficult to focus during a webinar. I've done a lot of webinars, and I know how easily distracted you can be. Some of you might actually be trying to do your email while we're having the webinar, or text people, or get up and go down the hall for coffee. And I know, because I've done all that stuff. So I would ask you to just give me an hour, just 1 hour of your devoted time where you're not doing those things, because I want this hour to be productive for you, and I want you to kind of get back to where you were on April 17th. I know we have some people joining who weren't there, and that's okay, because we're going to be reviewing that day first before we move on to conversation about it. So I would like for everybody to introduce themselves, and I'll go first. I'm Donna Wigand. I'm in LCSW by trade. I was in 4 different counties over 33 years, county mental health systems, and have a passion for public mental health and consumers and recovery and all of that good stuff. I was asked to work on this project and happily accepted, and I think that it's really important for us to look at the HR resources that are necessary in order for behavioral health to move into integrated services and to be successful and to be able to have the right kinds of staff in the right kinds of places. So that's me. Kristen?
Hi, I'm Kristen, and many of you know me as a project manager for the Greater Bay Area Mental Health and Education Workforce Collaborative. And I appreciate everybody coming on the call. We really just wanted to do this to help kind of really create or continue the momentum from the April 17th meeting, and to help connect with folks who weren't able to come, and to just keep kind of this work really in everybody's mind, and also just provide some really helpful kind of technical assistance if and when it was needed.
And Katie?
Hi, this is Katie Collison with CIMH. Just a few notes. Sanjita, I need you to enter in your audio pin in order for you to be unmuted. I can't unmute you until your audio pin is put in. I've sent it to you. It's #68#. And Charlie, I'm going to try to unmute you again. You might be the reason there's some feedback on the line, so you might need to call in if you can't fix your speakers, and I'll be handling all the technical aspects of this webinar. So you can send me a direct chat or email me and let me know if you're having any problems with the webinar. Thanks.
Okay, so I would like you each to introduce yourselves, and I'll call out to you, but a couple of things I want you to say. I want you to say what county you're with, of course, but also what specific position you're in that county, and how long have you been in that position. And because we are going to be talking about both HR and behavioral health staffing needs, just if you could talk about which side of the house you're on, or whether or not you've been on both sides of the house, because I know some people have. just so everybody gets a sense of it, I want you to imagine that you're all in the same room together, and I want you to introduce yourself as if you're introducing yourself to us face-to-face, okay? So Amy, could you start out for us? Amy, are you muted?
No, it looks like she's inattentive, so she might be on another screen.
She might be on another screen?
Oh, let's see. Yeah, it's telling me she's not attentive, so you might want to go on to the next person.
Amy, you're already not attentive. Okay, Carolyn, Contra Costa, Carolyn. No, we're having a problem here. Is everybody unmuted?
Yeah.
Muted. Unmuted.
Everyone should be unmuted right now. I see they are on their computers. They might be using their speakers without a microphone. I'm positing.
So this is a test. Donna, could you hear me? This is Sanjita.
Yes, I hear you, Sanjita.
Hi, Sanjita. We can hear you.
Okay, then that's good. Thank you.
Did Donna go? There. Looks like Donna's.
When are you?
There we go.
Donna's back. Okay.
All right, let's go back. Let's start over. Amy. Amy's not responding. Carolyn. Nope. Charlie.
Hi everyone, this is Charlie here.
Charlie, is that you?
Yeah.
Okay, could you please introduce yourself?
Yes, I am Charlie, and I'm the Tier Vocational Program Manager with San Francisco County Mental Health.
Having a hard time hearing you.
Yeah, there's some major feedback when I talk.
Oh boy. Okay. And you're a program manager for mental health. Charlie. Uh-oh.
Yes,
Okay, and with which county again?
San Francisco.
San Francisco. Okay, thank you. All right, Haiti.
She just sent me a question saying she's not sure if she has a mic with this setup.
Oh boy. You know, just FYI for all the attendees, if you don't have a microphone for your setup, then it's probably much better for you to call in on the phone, switch the audio to telephone, and call in
Donna?
on the phone.
Oh, there
Oh,
we
there
go.
you go. Can you hear me now?
Who is this?
Yes.
Okay, this is Ide. I'm the Associate Director with Peers.
Okay, for which county?
We're located in Alameda County.
Okay, great.
Thank you.
Hello, Donna?
Yes?
Hi. I finally got the audio to work. This is Caroline Season.
Hi, Caroline. There you are.
Hi. Sorry, a little bit of technical difficulties here, but this is Caroline Season. Good morning, everyone. I am the Ethnic Services and Training Coordinator here in Contra Costa County. I was actually one of the attendees at the forum a couple months ago. And so for our county, I've been here for maybe about close to 5 years, doing several things. So this is kind of the latest hat that I'm wearing. And I'm more involved with the training of current staff and also the coordination of incoming interns. And this includes clinical interns as well as peers as well.
Great. Great, thank you.
Okay.
Okay, Sanjita.
Hi, good morning, everybody. I'm Sanjita Mazid, and I'm the Workforce Education and Training Manager for Alameda County. And I've been with this county for 2.5 years.
Okay, great, thank you. Stacy. Stacy.
It looks like she's self-muted right now.
Stacy, take it off of mute. Stacy. Yeah, I bet she went down the hall to get coffee. That's a no-no. Okay. Let's go to Yang. Yang, are you there? Yang? Is that you? Hello?
She's trying to get on right now. Let me see if I can help her.
Okay. That's why we give ourselves 2 hours for these, guys, so that we can take care of the technical difficulties in the first 30 minutes.
And Katie, Amy says she needs some help unmuting as well. Amy does.
Amy
Okay.
should be unmuted. She might have to call in. If you're having a hard time with your speakers
Yeah.
or your microphone, you might want to try calling in.
Yeah, if you're, I agree. If you are unable to use the microphone on your computer, which was my situation this morning, I'm talking to you on a phone line.
I actually did both. I'm on the phone line and also on the computer.
Okay. All right. Okay, is anybody there that has not spoken? Amy? Oh, here's Melanie. Melanie, are you there?
Hello?
Hello?
Hello, can you hear me?
Yes, Stacy.
Yes, I'm in Caroline's office because we couldn't make my computer do it right.
No, yeah, I know. I had to call in on the phone line.
I'm on the phone line, and it still won't unmute, so I'm in Caroline's office. Fortunately, she's right next to me.
Good. Okay, so Stacy, would you introduce yourself and say how long you've been with the county and your position?
Sure. I'm with Contra Costa County for 26 years now. I'm a mental health project manager. I'm a personnel liaison for the division, and I did briefly for a couple of years work for health services personnel as an analyst. Then I came back to mental health because I wanted to work for Donna.
I think Stacy is in a unique situation that she has worked both sides of the house. And so that's very useful. And Stacy, I know you weren't at the April 17th meeting, but I think it's important that you be involved in this because you do have experience on both sides. So that's great.
Thank you.
So Yang, are you on yet? Okay, we can't get Yang. We can't get Melanie. How about you? Nope. And Amy. All right, I would like to encourage the three of you again, since we can't hear you and you need to participate, to use the phone to call in, and hopefully that'll be successful. Okay, we're going to go ahead then and get started on the meat of this. Is there anybody who does not have the draft of the process and content of the April 17th meeting? Is there anybody who did not get that? Let me put it that way. Okay, so everybody on this phone call got the draft from the Behavioral Health and Human Resources Forum in April. Great.
Yeah, and that's that's just like a working draft right now. It's not a final draft at this point, but it's something just to refer to, especially
Yeah.
there.
Yeah. We just wanted you guys to have something in front of you. It's not in final form, so you don't have to distribute it high and low. We're going to be adding a little bit of stuff to it. So just to review, I want you to try, it's been 2 months, I want you guys to try to get your heads back there, okay? And as you recall, just to give a little bit of background, some of you may have been involved in a similar forum that we had in 2011. And this whole process started because in 2010, the Bay Area Mental Health Directors and basically the Mental Health and Education Workforce Collaborative got together and said, you know, this is a situation that we have changing staffing needs. Really, at that point, back in 2010, they were looking at the fact that all of the kind of traditional mental health classifications were created in counties probably 20 years ago. And county mental health systems had moved well past a medical model by then and into really a recovery and wellness model, and a lot of the job classifications didn't reflect that. So there was a move to, at that point in time, look at particularly consumer providers, and how the fact that by 2010 most of the greater Bay Area counties had already were starting to hire consumer providers, and really looked at, you know, are you having difficulty in your county hiring them, creating job classifications, et cetera, recruiting, retention, et cetera. That's really what the 2011 forum focused on, and we continued that in this forum, but we added another agenda, and that was because basically I was hired to look at what were the needs of the counties now in 2014. Who's there?
Oh, this is Melanie. Can you hear me?
I can hear you now, Melanie.
You told me I was in listen-only mode again.
No, I can hear you now. Why don't you introduce yourself and your county and your position?
Okay, Solano County, mental health. I'm a mental health manager over our wellness recovery unit.
Great. And
Okay.
how long?
Oh, for how long have I been doing that?
Yeah.
Well, this time around, it's been
boy.
about a year.
Okay. Okay. So, okay, great. So then what we did in 2013, basically people started feeling like we need to have another one of these, because there's been a bunch of stuff that has happened in the meantime. You know, we've got healthcare reform and the ACA not coming, but rolling out, literally. And, you know, there's just been different things happening in the last 3 years. Most Bay Area counties have started some kind of integrated program between behavioral health and primary health care or public health. And there was this whole new branch of service delivery starting in terms of integrated programming with physical health care. And there had not been a concerted effort of looking at, okay, if we're going to go that way, and we're going to come up with these new integrated treatment teams that are going to be delivering both behavioral and physical health care, then what are the new jobs that we might need on those teams? What are the new skill sets that we need the behavioral health staff that are members of those teams to have? Because traditional mental health treatment skill sets are not necessarily the ones that are going to be successful when you are working with a physical health care team, especially in a medical environment. So we really started looking at that. I talked to about half of the Bay Area mental health or behavioral health directors, and they really solidified for me that they were feeling way behind the curve on this, that they had already, almost every county had started some kind of programming with existing staffing and classifications, which didn't necessarily fit the New World Order. So that's kind of how we came around to saying, okay, we need to do this day in April. Alameda County was the host county. They were wonderful in not only the venue, but which was downtown, by the way, but they basically not only welcomed us there, but really talked about their evolution, I guess is the right word, and how they have really come to understand the need for integrated services, and really have been working, both Tony Tullies, who's the deputy director, and then Mary Hondon, who is the manager of what they call their pool of consumer champions, which I think is a really cool name for it. But she told her story of how she, her personal recovery story, and really talked about what it meant to her to become an employee and in Alameda County behavioral health. But she really spoke to, and Tony really spoke to, the need for peer providers to be a part of the new world order of integrated programming, and to not be left behind, but to be also planning for what are the kinds of ways that we need to morph the role of the peer provider, which we are used to in one particular way, or maybe a couple of ways, in the mental health system, but what are the new ways that peer providers can really have value added to these physical healthcare integrated teams? So I think they set a really good tone for that. Okay, let me stop my blathering and ask, are there any comments about that? Is everybody remembering the day that was there?
Yes.
Sing out. Say yes or no.
Yes.
Everybody remembering this?
Yes.
Okay. So the keynote speaker was Bob Shabai, who is not only the current medical director of San Mateo County and the previous director at San Francisco, but also I've known him. He's a friend of mine, and he is a wonderful human being, as those of you who were there know. He is fantastic. He's a doctor. He's a physician, but he's also been a top administrator for years. So the nice thing about Bob and moving into integrated programming, and the nice thing for any county he's with, is that he has a foot in the doctor world, because he is one, but he has a foot in the behavioral health programming world. And so he really gets both sides of the house, and he's able to dialogue with the physicians on the healthcare side of the house really well. And as most of you know, a lot of times it takes a doctor to talk to a doctor, or it takes a doctor to talk to a doctor for that doctor to listen, right? So he really presented how what San Mateo County has been able to do. And they have, and what you have up right now on your screen, I hope everybody can see this, is the 4-quadrant clinical integration model. Is everybody seeing that on their screen?
Yes.
Yeah.
Yes.
Okay. All right, so I'm not going to go over this in detail with you and read it for you, because it's right in front of you and you can read it. But suffice it to say that most of the counties in the Bay Area are doing something in, not in each of these quadrants, but in one or two of these quadrants. So let me give you a more specific example, for example, from San Mateo. So Bob talked about 3 different models that they're doing. The first 2 are models that other Bay Area counties are doing, in my experience and in listening to other counties. One is that, the first one is that a primary care, behavioral health care team that interfaces with each other. So in other words, behavioral, for example, the mental health or behavioral health side of the house might send staff over to a healthcare clinic, like, for example, a psychiatrist might go over to a health clinic and be stationed there 10 hours a week to do consultations and maybe really, really quick eyeball assessments, but is basically there to give value added to the primary care health service team. So there's interface, but there's not integration. And many, I would say most of the counties at this point, not just in the Bay Area, but up and down the state, have some of that, where they take mental health staff and outstation them, or have them on call to the healthcare side of the house in some capacity. So he talked about that. The second kind of model was where you take healthcare staff, bring them over to the mental health or behavioral health clinic, and you deliver medical services now in the mental health clinic. I know that's happening in Contra Costa. I know there's other counties that there's happening in. And the benefit of that model, of course, is that most of the folks that have been coming to adult mental health clinics have been coming for a while or will be coming for a while. So that's the entry point into the system that they're used to being, and that's where they want to be, or at least that's the place that they identify as going in the system. And to get folks with serious psychiatric stuff going on, to get them on their own, to get up and go across town to a medical clinic, you all know what the likelihood of that is to happen. So the benefit of bringing the medical services to them is fabulous. And also we're able to get the medical staff to be a part of the behavioral health care staff, and that's huge. So the third approach, though, that Bob talked about was San Mateo got a special grant to do this third approach, and it's called a Total Wellness Team, and it's in the write-up, and they do use what they call peer coaches as team members. So they really use peer providers as coaches, mentors, which is a great role. And basically, the folks that are lucky enough to get enrolled in that program, because it's not everybody, they get a really enhanced array of services. And they track these folks because they have this total wellness team, which has medical staff, behavioral health staff, both clinical, case management, peer providers, etc. And they do really close tracking of outcomes, but not just the outcomes we're used to looking at on the mental health side, but their physical health outcomes. And sure enough, they showed, marked improvement. They have a dashboard, what they call the client dashboard. And those of you who were there on April 17th listening to Bob, in your packet that you took home with you, everything I'm talking about right now that Bob talked about are in handouts. For those of you who don't have the packet, we could send it to you. On page 7 of the packet, it has the client dashboard. Unfortunately, it's so tiny on the handout that at least these old eyes can't read it. But let me tell you what it does is every time that person comes in to a behavioral health clinic, their medical vitals are taken, everything is checked, diabetes, etc. And so it's really a medical dashboard for behavioral health clients, and it's a wonderful tool, I think, for any county to use. And so really they're able to much more closely track not just their social functioning, which we're used to doing, but their physical health. And so we all know in this business, unfortunately, that folks who spend a lot of their adult lives in our system of care with serious and persistent conditions, unfortunately, they die on an average of 25 years earlier than anybody else. And so I would venture to say that our folks are, in a healthcare crisis of gigantic proportions, and it's something that we all should have been paying attention to a long time ago. Fortunately, we're now able to pay attention to it through integrated programming. So what I want to refer you to in Bob's handouts is they did show a dramatic increase in wellness levels of functioning in terms of, just things like blood sugar management, if they were diabetic or pre-diabetic, blood pressure management, all kinds of things like that. And also their rate of hospitalization, both psychiatric and medical, dropped significantly, which I think is very interesting. And also the need for acute emergency care dropped as well, both on the medical side and psychiatric side. So that really tells you, I think, how closely linked these two things are. So let me take a breath again. And any comments? Any comments about what I've talked about the day so far? Questions? Memories?
I have another image if people want to just look at it real
Sure.
quick. Just this came from another webinar. Just this idea of kind of we have kind of a mismatch. Can you kind of see this a little bit going on? This is from another PowerPoint, but just with
There we go.
in the physical health center, you have 75-year behavioral health patients there, but you only have like 5% practicing behavioral health specialists. And in the behavioral health sector, people are getting there's actually 25%, if it's kind of by the whole behavioral health care population, are actually being seen in specific behavioral health care specialist locations, and less than 1% are medical specialists. So you can see a real imbalance, can't you? Like a huge mismatch in terms of kind of where people are receiving their services and what kind of services they're receiving.
Okay, any comments about that?
Donna, somebody's requesting if you can send a copy of the client dashboard. They say you're right, it's tiny print.
It's ridiculously small. Kristen, can we do that?
I don't know. I'll have to ask. I'll ask Bob if that's possible. But
Okay,
I'll look into that.
I'm sorry. Go ahead, Kristen.
Oh, no, I'll look into that.
Okay.
I have a question. This is Caroline.
Hi, Caroline.
Hi. The graphic that Kristen had just pulled up about primary care providers and behavioral health, I was just curious, was that data for California as a state, or I guess what region are they capturing?
I believe that was national.
National. Okay. Thank you.
Okay, any other comments, questions? Is everybody still with us? Checking in here.
Yeah.
Yes.
This is Melanie. I'm here.
Okay, good. All righty, because you guys are going to start talking a lot more than me in a little bit. Let me just wrap up the review of the day then. The rest of the day, by the way, we had a really good Q&A process with Bob Sabai, and those and you all that were there had a lot of good discussion with him about how they've been able to recruit, for example, psychiatric nurse practitioners, and kind of some of the mistakes that were made along the way, and just learning from that. And it was a really good, productive Q&A session, and we actually had to cut it short to have lunch because I think we could have gone on for a long time. So the afternoon, basically, we had 3 roundtables that you all participated in, and 3 separate ones. We had more than 3 tables at each one, but we had almost 50 people attend that day from almost every greater Bay Area county. I think maybe we didn't have one county, but everybody else we had. And so there, basically, we had heard from you all that you needed time to talk to each other, county to county, about what you were doing in your counties about some of these topics that I've just talked about, but also sharing information with other counties, but also learning from other counties what they've been doing. And there was a lot of that sharing and discussion and really good, rich conversation. So the first one went back to kind of the original forum back in 2011 and looked at, so what has happened with recruitment and retention of peer providers, and also family support providers, family member providers. What has happened in the last 3 years since we last talked about it together? And do you have particular recruitment strategies that are successful? How do you make sure you retain peer and family member providers, and also give them the support that they need in the system? Because a very common discomfort has been feeling like peer providers and family member providers don't get the kind of support that they need as staff in a large public mental health system. So lots of discussion about that, lots of discussion about how some counties have been able to create civil service county classifications and fill them. Other counties had not. And it was interesting to hear that some counties really wanted to do that and to create county positions, but had been obstructed by certain things in their county, certain processes in their county. Other counties really were choosing not to create county positions and choosing to use their contract providers to be basically the consumer and family member hiring authority, if you will. Just felt like that could be done a lot more quickly and easily by a nonprofit contract provider than by their county. So really it was kind of all over the map there. So just interesting differences there. And there were a lot of HR issues, as you can imagine, that entered into that discussion. And some of the issues that were talked about were issues associated with labor and unions. And that was always an interesting topic. And also just, you know, how some counties are reluctant to put in a job classification the MQ of having lived experience, and that there's some counties that just don't want to have somebody disclose that as a qualification. Some counties are okay with that. So it was, again, it was all over the map, but there was a lot of good discussion about that. Okay, is everybody with me still?
Yeah.
Yes.
Okay. Are you remembering this?
Yes.
Okay. So second small group was basically about what have you done in your county around integrated programming with behavioral health and primary care. And again, kind of those first two models that I talked to you about that Bob presented were the predominant models where behavioral health staff was embedded in a county health clinic. And then, you know, I would say fewer counties have embedded health clinic personnel into their mental health clinic. And then the last roundtable was how do we take the role of peer provider and really go forward with it into the new integrated programming. And so some of that conversation was one of the challenges is that the traditional medical model and the medical side of the house and health clinics really have not embraced, traditionally have not embraced having peer providers as part of their system of care. Now there are public health clinics and some health clinics that do have what are called health navigators. And those health navigators may or may not be peers or family members of peers. They do not necessarily have to be traditionally. So we really looked at how can we take our peer providers and do that skill set, you know, morph that skill set into a navigator. Navigator, mentor, you know, maybe a liaison, a whole new really job for folks on the health side of the house. But so basically we looked at how do you take our peer provider function and say now you're going to follow behavioral health clients who are part of this integrated healthcare team, and you're going to be a member of the team, okay, and you're going to do new things with these folks who need both mental health and health care. And what would that look like? And sure enough, I mean, not all counties necessarily share that vision. And so that led to a discussion about how do you work with the challenge of, you know, on the medical and health side of the house, they don't have a culture of including peers into a treatment team. And so, you know, the whole medical model thing was a bit scary to our peer providers because it really is a model based on pathology instead of wellness and recovery. And so, you know, there's a culture shift that has to happen, and we all know how long culture shifts take, right? And the thinking was we need to start these integrated treatment teams now. We know we're going to get some flack and maybe some outright discrimination towards our peer providers from the medical side of the house. And how do we work with that? You know, how do we work with that in a way that is not completely alienating, and so that we don't piss off that side of the house, but get them gradually to understand the value added by having peer providers and family support providers. So that is really a nutshell, and I know I've taken a very long time, over half an hour, describing that day. But I wanted you all to remember what that day was like, and those of you who weren't there to get a good sense of that. So let me say that, because now I'm going to shut up and you guys are going to do most of the talking. Let me say that when we left, you all, the participants, said, you know, let's have a follow-up to this day in a month or two, and that's what we're doing. But what we asked you to do is to leave that day to focus on, you know, pick one or two things, and most folks said, you know, one is enough, just from your discussions with each other that day, to pick one thing that you think that you could go back to your county and look at and work on, and not necessarily accomplish. You know, it's like, oh, you know, I did it in 2 months. But what activity of all of the discussion, you know, that did you choose to go back to your county and at least look at and try to maybe, you know, have some impact or have some positive momentum forward, you know, over the last couple of months. So I'm wondering if there's anybody willing to share either that or any thoughts about what I've been talking about. So I would like you guys now to unmute yourselves and to start joining in the discussion. So is there anybody here that remembers that last part I talked about going back to your county and looking at things maybe differently? Yeah. We have somebody named Harry on now. Harry, you there? Harry from Napa.
Oh, hold on. Let me get him unmuted. All right, try again.
So Harry from Napa? No. Okay. All righty. Melanie, how about you?
Yes, I do remember that. And I know Rachel Ford, who is our Consumer Affairs Liaison, she has been working with our behavioral health, our integrated care clinic that is currently under public health in Solano County. And she's working toward a half-time position for a peer to be assisting the individuals in navigating the system, basically, and making it a little, I think, a bit more user-friendly.
Nice.
Yeah.
And so is that funded or not funded, or how would that be managed?
You know, I would need to ask her. She is doing a consumer family advocacy committee right now. But my understanding is it is not, and that was a big concern for me personally, that that we would be asking someone to volunteer, you know, for half time, but not, you know, I don't know, maybe there's a stipend that's attached to it. But maybe other folks have some input on that.
So let me ask, does anybody from any other county that's on the line have experience with that? No?
No, none.
Wow.
This is Sanjita. Can you repeat the question, please? So are you referring to what Melanie just mentioned, the half-time position?
Yes.
So whether any other county has any experience with similar?
Yes, they're trying to get, if I'm correct, Melanie, they're trying to get a half-time position to go over to a physical health clinic?
Right. It's we call it our integrated care clinic. It's behavioral health and...
To be a navigator?
Yes, yes.
No, we are talking about, we submitted, Workforce Education submitted a proposal to Tony many months ago, actually, for similar roles, but it hasn't been funded yet. I mean, we did not create the project yet. It's our recommendations were submitted. So unfortunately, no, I cannot speak to that.
Okay.
Yes, this is Caroline. Contra Costa has actually planned for a similar position, but we have not yet kicked off and filled it yet. So, I mean, ask us the question in a couple months. We might have some input.
So, Caroline, what's the specifics of the position that you're talking about?
I'm referring to Stacy, and we're not quite clear. I think that's part of kind of the discussion and the planning that's going on right now. But it is to, yeah, it's to place. So in Contra Costa County, our peer positions are formally called community support workers, and it's to place one community support worker in is it psychiatric?
Yeah.
Yeah, in our psychiatric emergency services unit. So, the planning is still, it's the duties and the positions are still kind of taking shape now. So,
okay, this would be a peer provider who would go to psych emergency?
Who would be placed there, yes.
Okay, so not the health clinic.
No. Oh, wait, we have one at the health clinic too?
Well, we've got a health clinic, a behavioral health clinic that opened a primary care clinic on the first floor a couple of months ago. So they are working together in Concord, in our Concord clinic.
Right, right. So, okay, but again, so that's the model of integration where you take health staff and integrate them into a behavioral health clinic, right?
Yes.
Yeah. So what Solano was talking about is getting a peer specialist position to go be a part of an integrated healthcare team.
Correct.
So is that happening?
Not that I know of.
Okay. Okay. So that's another, yeah, that's another form of integration. But the fact that you have healthcare staff coming to a behavioral health clinic, and I think, is that 20 hours a week?
No.
I'm sorry. Yes.
In Concord?
It's halftime. That's right.
Is fabulous. You have a part-time medical clinic and a full-time behavioral health clinic. I think that's great.
Yes, and it's caused our peer providers, it's given them a lot more work, actually.
And probably different kinds of work.
Exactly. Well, yeah.
It's great.
What does that position? What exactly does that position do? You're doing that now. This is Melanie.
Are you asking about the Concord clinic?
Yes.
Okay. Well, we have community support workers who work in the mental health clinic in Concord, which is upstairs. And a couple of months ago, they opened a primary health care clinic downstairs. So our community support workers are working more with the physical health team downstairs because a lot of our consumers, of course, need that physical health care.
Right. So what do those workers do?
The community support workers?
Yes.
Well, they do a variety of things. Unfortunately, a lot of what they do is transportation, but they also run some groups and they work on the wellness recovery action plans with the consumers.
Nice.
Yeah, they're part of we have teams. There's a psychiatrist and a team leader, a clinician, a community support worker.
So, Stacy, is one of the new roles for the community support workers since the healthcare clinic opened within the four walls of the behavioral health clinics, is one of the new roles, do they go to the medical appointment with the consumer? Do they sit in on
the Concord Clinic because it's just right downstairs. But I know with the Affordable Care Act, they're taking them to a lot of, not just at the Concord Clinic, but the CSWs are now taking them to a lot more medical appointments.
Okay, so I guess my question is, other than just the transportation piece of it,
right?
Is I think the goal is to use a peer provider to become a part of the care team, and to if that peer provider is in the session, in the medical session with the client, and it's actually part of the service delivery, and then can actually follow that person, and interact with that person in a different way. Like if they know, okay, your blood pressure's going through the roof. Right. You know what I mean?
Yeah, I do. And I hope that's happening. We were wanting to have Susan Medlin on the call today. She's our Office for Consumer Empowerment Coordinator. Right. And she meets regularly with all the CSWs about what's happening out there. Right. But unfortunately, she wasn't able to make the call.
Okay.
She could have given us a lot more information.
Okay. Because what we, the larger we, are trying to do is to figure out new ways that peer providers can be used in the medical world. And so if you in Contra Costa, you guys already have a 20-hour health clinic within your 40-hour behavioral health clinic. And if your peer providers in that clinic are or can be used in a new way, where they go to the downstairs of the medical appointment with the person and are part of the process, and then learn, okay, Joe has a blood pressure problem, Sally's pre-diabetic, la, 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 and can really kind of start being working on those issues with them as a peer. That's really a whole new skill set. You know what I mean?
Yeah, it could be happening. I really don't know. I'm sorry. Susan, we could have more information on that, but I hope it's happening.
Okay. Okay. Yeah, it's a new role, and I think it's something that, everybody, a lot of counties are talking about it, so. Okay, what about, Chris, are you on? Chris from Marin? Hello? No, Chris and Harry we can't hear.
Oops, here a little bit. While people are trying, can you hear me okay, Donna?
I can hear you fine.
Yeah, okay. While people are kind of figuring out unmuting and the like, couple of things that your last conversation really brought up, which I think is helpful, and maybe part of the things that people are thinking about, is that I think there's a lot of agreement that peers play a really important role in various places. So I think what you're talking about in terms of helping to actually figure out the roles is helpful, because without the kind of roles being carved out, sometimes there can be a lot of good intentions that then doesn't follow through. So just even thinking about the roles right now, getting to the point of even just discussing and creating some sample job descriptions is a good place to get started. And then I think there's also the other important issue around, well, who's funding some of this? Because I know, like with Bob's presentation at the forum, he was talking about a program that was being funded by a SAMHSA grant, some innovation monies. So really thinking about, well, how is some of this happening? Because again, there's a lot of need, and people understand it's kind of the direction to go, but there isn't necessarily a whole lot of financial follow through at this point. That the links haven't all been made.
Okay, so some of you we still can't hear, unfortunately, but others we can, fortunately. So who else would like to share what the takeaway was on the April forum, and what have you done or not been able to do in your county? Who else would like to speak up?
Hi, Donna. It's Sanjita.
Hi, Sanjita.
Hi. Okay, I can talk about it. You know, you were talking about peer employees. It's an evolving issue. I think everybody agrees that this is a great thing to do, and some counties did more than others. Like in Alameda, we have over 200 employees, not all in county programs, but in the CBO programs. However, you know, what would be their role in that, because of the health reform? You know, I do not know. I think we all are talking about it, but we have the vision, but it hasn't come to in the form of a program yet. That's what I can see, that's what I see and I hear. Just recently, less than a month ago, we have an what do you call, focus group for workforce needs assessment. I'm actually working on a survey to identify the current needs of, you know, behavioral health in terms of the healthcare reform and whatnot, and of course the integration. So we all talked a lot about the need for peer employees. Everybody agreed that this is needed, but I don't think, you know, I heard this is how we want to do it. And of course, it's going to be different for different CBOs. So that's the reason I can't give any concrete example of, you know, this is exactly what we are doing, just the way Melanie described that they are hiring or they are in the process of creating a position. We have created many, many, many positions, but in the new environment, what would be their role? I think it is still being discussed. So in terms of activities, there are a couple of activities that we have done since our since HR Forum. One of the things is the focus group, you know, that I just mentioned, because we have been working on putting together a survey to identify current workforce needs. So we invited about 42 people, and about, I think, 30 people actually attended the first focus group. We have had a lot of good conversation, and the summary of the focus group discussion is going to go out to the attendees and also the non-attendees for additional input if they didn't think about, you know, to share some information on the day of our focus group meeting. And after that, I'm currently actually working with a consultant, and based on our focus group discussion, she is going to be working on a survey which will be going out to all the CBOs and also county programs. So hopefully we'll find out, you know, what are their needs, and based on that we'll start you know, prioritizing some of the program development ideas. So that's one thing we have done. And then I mentioned at the HR conference about that we are working with UCSF and creating clinical training program for psych nurse practitioners, and that's actually going very well. It's a lot of time and a lot of, you know, work. However, I was able to work with 2 of our adult clinics and our children's clinic, and we are going to place a couple of students from UCSF. It's in the final stage now. So that's you know, something that I think, you know, something positive happened since the forum.
That's great. So and this specifically is the psychiatric nurse practitioner program, right?
Right. So I started having conversation with our exec team. Yesterday I had a meeting with one of the managers who is in charge of, integrating behavioral health with primary care. I wanted to get his input, and basically I am also learning how our system, our model, because what kind of model they are envisioning. I am not part of every conversation. So I need to know, what kind of model of integration our managers are thinking.
Mm-hmm.
So he is, everybody thinks it's a great idea of creating the pipelines, developing the pipelines. And my next step is, and I'm pushing this, okay, I understand we are providing training, but what is next? Are we thinking about, creating positions for them? So that I want to see that, they are linked with our system, not just the county system, also with the CBO system, so we don't lose them.
Mm-hmm.
So this is what I started, doing, having discussions, having some conversations. We had an expanded admin meeting last week, and I raised the same question again, and we had our director and medical director present at the same meeting. It's all the managers meeting. So we'll see. It takes a lot of time just to understand the concept, and there are other issues, infrastructure issues, politics. That I don't have to say all of it. So we started thinking, and I have a lot of support. However, we just don't know yet, where we are going to be able to, and when we are going to be able to hire these trained psych nurse practitioners.
Sanjeev, you're talking about something also that Bob talked about in his discussion. Maybe you could share with the group why you're focusing on psychiatric nurse practitioner in terms of developing a pipeline. Why do you want that particular job classification?
We have actually a classification. Classification was done. But in our system, we have not, in my knowledge, we have not hired nurse practitioners, psych nurse practitioners. However, a couple of clinics, they are working, they have employees, actually they have psych nurse practitioners working. But those are they are not in our clinics. Basically, it's like Lifelong. Lifelong is a CBO clinic.
Okay.
So I'm going to be working with them. They send their staff to our clinic. So it's like, one model that you mentioned, for so many hours, people send, agencies send their staff to work in collaboration with behavioral health care. So I think something similar to that model is working in a couple of clinics in our system.
And those clinics are run by CBOs?
Some clinics, Oakland Clinic is actually a county clinic, but many clinics are actually run by CBOs.
Okay.
We have a very complicated system. I just, yesterday I was able to gather a list of all the different clinics being operated by CBOs and also by county. So I'm learning.
Okay. And so the benefit of having psychiatric nurse practitioners,
because they can provide both physical, they can work with physical health issues and also provide mental health, care. So they could be the cornerstone of integrated care. That's how I understand it.
That's exactly right. So the benefit is that they're nurses, so they can do all that nursey stuff, all the medical stuff that nurses do, but they're psychiatric specialists. So they really understand both needs and can work both sides of the house. You're absolutely right.
Yeah,
it is an underutilized classification, I believe,
exactly.
in public behavioral health. and I think, you know, that many counties have a goal of developing a pipeline and hiring psych nurse practitioners, and I think it's something that a lot of counties are working on. So thank you for bringing that up and talking about that.
Hello, this is Chris from Marin. We definitely have our NPs too. One of the challenges that we find is having the medical supervision. If there are sort of county and psych NPs, that they're under the supervision of a psychiatrist, and some of our psychiatrists are not comfortable making medical decisions and supervising them to medical issues. So I'm just curious how you guys are working with that. Or if maybe it's not a problem over there.
Sanjeev?
Are you asking? Oh, okay.
Sanjeev, sorry.
I don't know yet. These issues, you know, have not been discussed yet because our program just started. So, and their focus is on training nurse practitioners on psychiatric issues. This issue came up. Actually, I got an email from our Oakland clinic that, do you anticipate these nursing students working or getting training in primary care issues too? So I'm actually waiting to hear from our UCSF contact. So
okay.
These are all evolving, so I don't have any answer for that yet.
Okay, thank you. I was just curious because, I mean, we certainly use our NPs in that way, but one of our challenges has been that we need to find a medical person to supervise them, and we've been previously partnering with our one of our FQs to do so, but that relationship, I think, is changing a bit. So
now, is Aaron Miller providing psychiatric supervision to your?
New to our system. He's working as an NP on our child team, and he's a clinical professor there. So we're hoping to develop a pipeline as well with him to bring in new NP students, and we're working on that one as well.
Yeah, he's working with us also, and also a couple of other faculty members.
So does anybody else on the line have experience with psych nurse practitioners in their system, or recruiting?
None in Solano County.
Well, it's interesting to have these conversations too, because I think sometimes we don't know what we don't know in terms of kind of mixing the cultures, like what's going to come up. Because what Chris just brought up, something I actually hadn't considered before, just the psychiatrists and then their own kind of questions about their scope of competence or what have you in terms of their own practice. And I've kind of heard it the other way in terms of people being concerned about NPs prescribing, for instance. And so it's interesting kind of all the different issues that might pop up as kind of cultures and practices start to mingle. I think it's good to keep having the conversations though, so we can start, people can start problem solving. And I think the faculty liaisons are really helpful people to know, because I think they're really at the cutting edge of figuring some of this stuff out.
Yeah, this is very, very different than having interns from social work or MFT programs, and it could be also because the graduate internship programs have been in place for many, many years, so it's more developed. However, the psych nurse practitioners program, it's a very new thing. The requirements are different. Finding a preceptor is not always easy. I'm experiencing something very interesting. Actually, this clinic is very interested to have one student, but she doesn't have workspace for the student. So, and I think we should be able to resolve this. All we need is just a computer and a desk, in a corner, and it's not for every day, just a few hours for a few days a week. But again, it's not something I can make the decision about. So I'm working with the clinic to see if we can resolve it. And the LCSW clinicians can also supervise the psych nurse practitioner, the students. So it's not we have an option here. And this clinic manager, she is an LCSW, and she is very interested to have one student. So infrastructure, all kinds of issues are coming up.
Okay, I am seeing in the question column by your names that Harry has an unanswered question. Now, for whatever reason, I'm not seeing any chats or on my screen. I don't see. I have blank chats and blank. So I'm not seeing any. On my screen, I don't see any messages. But I have a question mark. Whoop. What is that? There we go.
I think I just made you an organizer. So you should be able to read Harry.
There you go. Now I can see. Awesome. Okay, Harry, you have an unanswered question? Go to question.
Do you see it?
Oh, here we are. Questions. Oop.
Okay, lost that piece. Oh, here we go. See it?
Oh, now I can, but I can't really see it. What's going on?
You have to grab the box, Donna, and just kind of pull it out and embiggen it on your screen.
Yeah.
I can read it if you want to.
Yeah.
That's probably a good idea.
Okay, it's from Harry. I don't have a mic on my computer, no problem. Regarding MPs, we are fortunate that our psych medical director is able to provide supervision for the relatively minimal medical care our psych MPs provide. More complex medical issues are warm-handed off to our on-site FQ clinic. So there's a good example of working with what you got, kind of figuring out ways of doing workarounds. I mean, it's always best, of course, to have systems start to develop in ways that we don't always have to do tons of workarounds, but when we get started, that's kind of what we got to do.
Okay. I am trying to get my, I'm trying to be able to see the questions. I'm having a hard time.
Donna, if you grab the
yeah,
tab.
I know what you're telling me to do. It's just not working.
Oh, here one.
Donna is technologically challenged.
I can't get there. Okay. I think those are the main questions, actually, at that point. Oh, here we go. Might be some more. Yeah, I think most of the questions were just around having a hard time working. I think that just Harry's comment.
All righty. Okay. Does anybody else have something to share about what you've been looking at since April 17th? I know you each identified some things that you wanted to look at back in your counties.
Hey, Donna, this is Caroline. I'm willing to share kind of what we walked away with for Contra Costa. So during our...
Muted. Unmuted. Muted.
Oh, hello, can you hear me? Donna? Oh, hello?
Hello, can hear you.
Hi. Sorry, Kristen, did you catch the first part that I was saying?
No, I did not. I got muted somehow.
Oh, you did? Okay, strange. Okay, so anyway, this is Caroline from Contra Costa. I'm going to share kind of what we walked away with during our April forum. So our follow-up activity for Contra Costa was to explore expanded roles of peers working in our system. Now, since the forum, I've had a couple of meetings with the manager for our Office of Consumer Empowerment, Susan Medland, who unfortunately couldn't make the call today. She would have, a lot of rich input, but unfortunately she couldn't make it. And so we've had a couple meetings to kind of explore this idea, and it's really prompted by some recent events, including the planning for our new peer personnel program, training program, and as well as our incoming cohort of peer interns coming through the community college through our Spirit program. And so it was, the timing was kind of right to have these conversations with Susan. And also it's just kind of a pivotal time for our county as we're in kind of the initial stages of behavioral health integration. And so we've been having discussions around kind of how we operationalize non-traditional roles of peer staff in our system. We've had the classification in the county for peer personnel, the community support worker title for a couple years now, and so we've been exploring kind of new placements for them, in terms of like internships as well as actual employment, and this includes a community support worker working in the psychiatric emergency services unit, as well as working in some of the shelters that we that we contract with under homeless programs. We're also planning for one of our peer interns to be placed with Alcohol and Other Drugs Administrative Office. One of the projects that has kind of been in the works for a few years now, but it has had a little bit of trouble getting off the ground, is our wellness coaches. So the original plan, and actually this is funded under an innovation grant in our county, but the original plan was to place a peer, a community support worker, one in each of our adult clinics, and work as kind of a wellness coach and be kind of a liaison between mental health and primary health. And so we did a short pilot over in our West County clinic that lasted for a few months, and we were able to collect some data from that. So the community support worker was working with a public health nurse, and they would track different points of data related to vital signs. So they were monitoring cardiovascular health to monitor whether or not they had high blood pressure, were a candidate for hypertension, and also monitoring their weight, and also helping with smoking cessation. So unfortunately, that's about kind of the extent to what I know about that. Susan was kind of heavily involved with that, but I know that the plan is, kind of still out there to implement the wellness coaches in each of the regions, and I think there will probably be more of a push for it now because of integration and also co-location of services out in our Concord clinic as well. And so I think just in general, at least from my point of view, just kind of some of the challenges related to, this planning of peers working in our system and also working in these more non-traditional roles is really being mindful that we want to create kind of a diverse workforce, and this kind of spans across ethnicity, age, and just life experience. And so our next steps are really include strategizing around recruitment and being intentional. That is kind of one of our purposes.
That's great, Caroline. And so the whole issue around using peers as wellness coaches, is that what you call them?
Yes, that would be their official title just for this innovation project. But they would
okay, that's great. But and innovation, you mean MHSA innovation money?
Correct.
But that really speaks to, and I mean, it's kind of like what's in a name. But when you say wellness coach, that's really clearly an indicator, a marker that you are taking a position that has been classically, doing something else, okay, like community support workers have been traditionally doing a lot of other things, and kind of earmarking, this new skill set and saying, okay, we want you to do this now because it's a new environment, it's a new gig or whatever. So, right. I mean, that's really exciting. Where you're saying,
and I think now the focus is now shifting to not only treating the mental health side of things, but also to kind of look at one of our clients is more holistically, and also kind of bringing in some of the primary health indicators and tracking those as well.
And that's exactly that dashboard that I was talking about that Bob presented that was really tiny, that we couldn't see. That is exactly what you're talking about, is looking at health indicators and tracking them and monitoring them. So I think that's fabulous, what you're doing.
Exactly.
That's great.
Thank you.
Great. Any other counties? How about Yang? How about you from Sonoma? Are you with us?
I think Yang has issue with microphones, so might be able to type something in from some.
Type something in, Yang.
Well, this is Chris from Marin. I could give a quick update and sort of in our exploration of this is in terms of the positions being county employees for peers. We don't currently have a classification, so we're working with our HR to kind of create one. There are some opportunities with our SB 82 grants, the triage and the wellness, which we're going to have peer staffing for. The challenge we've been finding, though, is that if we, there's this, in our HR world, there's this county classification called special assignment, which if there's no county class available for it, then you can hire someone into that. But the downside that we're finding is that does not allow benefits. It is a fixed-term position without benefits. So folks who might be, leaving their disability or their Medi-Cal to come into full-time employment would have to give up their benefits, which I'm not sure we'd be successful in recruiting folks for that. So that's been a challenge that we've been facing the last couple months since our last meeting.
Wow. So yeah, that was, one of the things that was identified in this whole process is, particular counties' rules and regulations, and every county, you've seen one county, right? Everybody is different in terms of what they will allow and won't allow. And that's a unique thing for your county, that it's a big challenge. And nor would you want to recruit folks away from their disability benefits to employ them and have no benefits.
Exactly.
It's like, yeah, let me get
you a job, but then you have to be on your own. So we toyed with the idea of, well, maybe we could go on Cover California and figure out how much a reasonable plan would be, and then add that to the salary. But that's just, pretty darn complicated to figure out what that would actually look like to make it financially doable for someone.
So are you in discussion with HR about this, or how are you?
We're in discussion. We have one peer classification, but it's not at all relevant to the peer the type of peers that we're speaking of. But so that won't work. So we're in discussion about having to create a classification, but that's I don't know if anyone's ever worked with HR and classification creation. It's not a quick process.
Right.
So we'll likely have to RFP the peer positions, which is no problem, but it's I think not where we want to be.
Right.
Exactly. Okay. Anybody else? Can anybody else share what they've been looking at back in their counties? Harry, are you with us from Napa?
I think while everyone's thinking about how to get on or typing in things, I just like to say, I appreciate
there's Harry.
Oh, here's Harry. Talking?
Oh. Harry doesn't have a mic on his computer. Regarding nurse practitioners, we are fortunate that our site medical director is able to provide supervision for the relatively minimal medical care our psych NPs provide. More complex medical issues are warm-handed off to our on-site FQ clinic, right? Okay.
I read that one earlier.
Right. Heidi had to leave the call, but she looks forward to continuing the conversation and the updates. Okay? All righty. Anybody else that we haven't heard from? Charlie, how about you? Charlie. I don't know if Charlie's still
Hi, Donna. Can you hear me?
Yeah, I can hear you really good now.
Oh, okay. There's quite a bit of,
well, not now.
okay, good.
Okay, you need to be
close.
close. There we go.
Okay, there's a little bit of feedback here, so I'll try to talk quickly. But unfortunately, I wasn't able to send the form. However, I did need to.
No, now see, you're kind of fading away now. Whatever you were doing before, do it again.
How about now?
Yeah, not really.
Yeah, let me try to type something in. Sorry about this.
Okay, we can hear you okay.
Hello?
Charlie, you still there? Uh-oh. So, Charlie, can you hear me? Okay, well. You know, we can hear you, but it's very, like, metallic and strange sounding.
Yeah, it's at my end as well. Why don't we try to type something in? Sorry about that, everyone.
Okay. Well, if you can type something, that'd be great, because I don't know if we're going to be able to.
Donna, it's Katie. I just sent you an email with Yang's response to your question.
Okay, let me see. Where do I find that? Because it's not showing up.
Should be in your email. I just forwarded it.
Oh. Oh. That I can do. Okay.
I got it, Donna. Do you want me to read it, or?
I just got it.
Okay.
Okay, Yang says, I am currently working with County HR on job announcements to recruit for extra help peer support assistants and peer support specialists. Those are the working titles. Using the approved civil service classifications of client support assistant and client support specialist. So, Yang, it sounds like you already have a civil service job called client support assistant and client support specialist, and you're taking those and morphing them into peer support assistant and peer support specialist, and that your county HR is going to go ahead and create a job announcement, and that sounds like you're actively recruiting for that. So, okay, great. Okay. Anybody else? Charlie, I'm sorry we can't hear you very well. I know that you were going to share something. Was that you? Charlie, one more time. Let's give it a go. Nope. Okay. All righty. Will anybody else have any topics to bring up? Any questions for each other or us? Okay. I'll take that silence as a no. So let me ask you guys. This is great. We can end sooner. We don't have to do the whole 2 hours, but I do want to ask you guys for some immediate feedback about both the April Forum and today. So those of you who were at the April Forum, the question is, I mean, I think that was a useful process. The question for you is it something that you would want to do again in, next year or whenever? The second question is this a useful process? Having a follow-up. Kristen and I had discussed doing a second webinar in October. That's 4 months away. Just to check back in with each other and share what has happened in your counties in the next 4 months. And that would also be, pretty much 6 months since the HR Forum. And so basically we'd be regrouping in October to ask, it's been 6 months since we saw each other. What have we been able to do? What were we not able to do maybe, and why? Just kind of learning from each other about what's going on in each other's counties and how people did, people who were successful, how were they able to do things, what strategies did they use? So that's the question. Really, do you see an HR Forum in the future, maybe next year, and do you want to regroup in October? Anybody who wants to speak out now about how you feel about that, great. If you want to give me or Kristen written email about those questions, please feel free. You have both. I think you have both of our email, so you can let us know how you feel about either or both of those options.
And just to let people know, when I was organizing this, I may have told you all this, but a number of contract providers came and wanted to be a part of the whole kind of county HR one. And we really wanted to keep it focused on just the real particularities of counties, even though they're all quite distinct as well. And we actually had a really good turnout with just the counties, but we think it's a great idea to do one with contract providers because they hire so many peers, and they have, you know, some similar and some different situations. So it makes a lot of sense. So we were looking at that for either the fall or early next year as well, to do an HR forum for contract providers.
Okay?
Yes.
All righty. So does anybody have any immediate feedback for us around those issues?
This is Melanie. October sounds fine to me.
For another webinar?
Yeah.
Okay.
Maybe to like what you said, follow up with where we're at and what worked, what didn't, and why.
Okay.
Yeah, I agree. This is Chris. I agree as well. And it would be great at that point, certainly, to begin sharing information amongst counties, like different classifications, if people have things like that. I mean, as I'm in the process of working with our HR, if I could have something that's already kind of pre-written around that, would be easier for us to develop one.
This is Stacy from Contra Costa. I can email you our job classifications.
That would be wonderful. Thank you.
Okay.
You know what I'd like to do is any of you who are willing to share your job classifications, you know, let's have those centralized so we can send them out to everybody. Kristen, is that okay?
Absolutely. That'd be wonderful.
Okay, so those of you who have written job classifications to share with other counties, Kristen, you want me to have them email them to you?
Sure, that'd be fine. We could do that.
Okay, so please email those to Kristen Dempsey. So that's kdempsey@cimh.org, right?
Mm-hmm. That's right. Here it is. It should be there somewhere.
And Dempsey has 2 E's, correct?
Yeah.
Yes.
And Chris, well, just yes, K Dempsey.
kdempsey@cimh.org. That way we can centralize the job descriptions, at least for the Bay Area, and then send them out to all of you all. That would be a great concrete thing to do for each other. Okay, anybody else? Sorry, I'm having a coughing fit here.
Mm-hmm.
Okay.
Just
well,
one last thing I
want
to say.
All of you.
Oops, I'm sorry, Donna. Just one last thing. Sorry about that. I didn't want to talk over you. Is, for the document we sent out today as a draft, so we're not distributing that, so that was just for your information, but we will have a formal, you know, more kind of pretty document that we'll send out to you all about the actual April form that you'll be able to distribute as well.
Okay.
That's all.
All righty. Okay, well, thank you so much for participating, and I will talk to you all in October, if not sooner.
Thank you.
Thank you.
Thank you.